Hello and welcome to this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network, and joining us in studio today, a return engagement. She's back. Cheryl Bartlett, the CEO of the Greater New Bedford Community Health Center. As we hit the summer season, I thought it'd be great, and she agreed to come in and sort of update folks on where we stand in general. I know summer season is great. People are out and getting back together again, and you know, some people have said this is like the first summer of normalcy. I don't know if there is a normalcy after this, but maybe they're right, but thank you for coming in. I appreciate it.
Oh, I always appreciate the opportunity, Jim.
So as we hit the summer of 2022, and you've been in here now since this started for 3 years doing updates, what's your overall assessment as to where we stand?
I think we stand with the public that really wants it to be back to normal. And I think many people are living that old normalcy that they had, which I think is a false sense of security, because I don't think we know for sure that we won't have another surge. It appears this Omicron variant of the coronavirus has multiple iterations of it, and each iteration seems to be more contagious than the one before, meaning that more people get it more quickly, but at the same time not as sick, and less deaths, less hospitalization, which is one of the things we look at as, are people dying, are they very sick, how can we take care of people? And I think the jury's out on all of that. So I think we have a public that's sort of done with the lockdown and restrictions for the most part. I think there's a small percentage of people that are being very cautious, concerned about their own health or someone that they live with. But I just recently traveled back from Florida, and I would say less than 10% did I see mask wearing on any in airports and on planes.
Really?
So
I was going to ask you that.
I think very little protection going on. So I think we'll see what happens with all of that.
Now, in the past couple of years, summer's been different because you're outside more. And traditionally in the summer season, the past couple of years, the case numbers have gone down, and the seriousness there hasn't been a surge. I would assume that kind of you would think that still kind of holds true this summer.
So that's what I think is the uncertainty, and everything I'm reading. Last summer, people were saying, oh yeah, outdoors, less risk. This summer, I'm seeing some of the experts that were more okay with last year than this year, saying we don't really know because of the infectiousness of this particular variant. I guess there's now version 0.4 and 0.5 that some people say are more contagious than the first Omicron that we had. So I guess I don't know. I read conflicting information, and so that always makes me cautious because we don't have unanimity in the medical community saying, summer, don't worry so much.
No, it's true that the numbers are down. I mean, I saw the latest numbers from the state. I looked on it before we came on. I mean, you know, hospitalizations down, deaths are certainly down. Doesn't mean though the people still aren't getting it.
Right.
And that's really the only thing that I guess the state's really going on is just who's hospitalized and how many deaths, because you could test positive and nobody really knows.
Correct. And a lot of people now with home kits, more testing is done that isn't reported. And so I think whatever DPH reports, there's much higher numbers of that, because we had a little surge in our health center with our staff over Easter, and all those people tested with home kits. So none of those go into the system of reportable diseases. So I don't think we know for sure what the number of positives are. We know they're not as sick, so sometimes they're not even symptomatic. So I think we're at a time of it's changing enough to create uncertainty, and also, again, a public that's a little weary of all of the restrictions that their life had on them. So I think it would be hard to put the genie back in the bottle, so to speak, and say we got to go back to strict masks and social distancing. I don't think the public can sustain that level of a public health response.
And it's funny because you mentioned about the masks. I mean, I know that, if I'm just bopping in and out to the grocery store or something, getting one or two items, I'm probably not wearing a mask because I'm just in and out. But if I'm shopping, I'll probably wear a mask because I'm going a lot slower and interacting with people. It's sort of just based on your surroundings. That's how I'm looking at it.
Right. And I think that that's what's important for the public, that really if you wear a mask yourself, you're protecting yourself, even if there are people out there. So the thought that everybody has to have a mask to have some level of prevention isn't necessarily true. So if people are uncomfortable and want to be protected, wear a mask. What we have to do is accept each other's decisions on what you choose, that level of risk that you want to take with this virus as we still are learning about it.
And I know the CDC, I've seen I've been watching the Red Sox games and just on TV, the CDC has come out with, seems a more aggressive take the vaccine approach too on commercials and stuff like that. It seems like there's another big emphasis on getting your vaccinations right now.
I think that that is the one consistent thing we've seen since the vaccines came out, is that vaccines reduce the number of infections, they reduce the severity of it, which means less hospitalizations and death, which is one of the goals of the vaccine. Some people think the vaccines should be 100% preventative, and no one ever has said that. But it certainly has decreased the level of severity and the number of infections.
And that's been the whole target the whole time.
Correct.
That's the goal.
Right.
And the vaccines now are available for younger kids, even toddlers now.
Yes.
And I don't know how that is going. I haven't really seen anything I know parents are a little reluctant, I still think, on it, but I haven't seen numbers yet to see how that's been going.
So I don't think we're putting the same push forward that we did with the larger adult population, where we had big clinics and tried to get people in on a Saturday and vaccinate as many as we can. For example, we did that at the health center. We had vaccine clinics every day. We have now put that back into the primary care practices. So in our pediatric practice, when kids are coming in, they're offering the vaccine. So kids get less sick than even adults do, so there's some resistance there, and there's some education gap. A lot of our pediatric population is a Spanish-speaking population, so there's always been some hesitancy in the Spanish-speaking population.
And we talked about that
Right.
previously. Did you see any, I don't want to say increase, but did you see more people getting the shots? The Hispanic community or the black community or what have you? Because I know those folks were reluctant. We were trying to target them. The city was really trying to target them. Did we ever, you think, get over the hump?
I would say we might have moved the needle a little bit, but not a lot. We didn't move the needle big in New Bedford overall for vaccinations, so I think we're stalled at somewhere in the 60%
right.
of people that have been vaccinated completely. And so that's kind of low compared to the rest of the state.
Interesting, though, when I saw the numbers, like the surrounding communities aren't much higher than that either.
Right.
Which I thought that was curious that, you know, okay, New Bedford's at 60-ish, and there's not really other places that are doing a lot better.
Right, right. In the South Coast.
In the South Coast, correct.
Yeah, correct, yeah.
I don't know if it's a regional thing or what have you. Just from what you've read and what have you, when you look at the shots and the vaccinations for toddlers and whatever, you're recommending kids get it if they so choose.
Absolutely, yes. We're offering it to everyone that comes in. It's Pfizer and Moderna both have a version of it for kids. One, and I'm not going to remember which is which. One of them, it's a 3-shot series, and one, it's a 2-shot series. So.
And the difference from those vaccinations versus what we got as adults is what?
The dosage, the amount of the vaccine. So when we got them, I think we got a half of a milliliter injection, and for the kids, the youngest kids, I think it's a 0.25 milliliter injection. So the dosage will be smaller. Excuse me.
And the safety issues are the same, really, as for everything. I mean, the goal is to keep the kids from getting seriously ill and hospitalized and what have you.
Right, and a part of it is also about the herd immunity, community immunity.
Right.
If we get kids vaccinated, because without it, they can transmit it to other people that are at higher risk and maybe risk for death because of their immunocompromised status, or they have multiple chronic conditions. So part of an overall public health strategy is getting as many people vaccinated, which limits the number of hosts that you have for the virus. Therefore, you can transmit, hopefully, fewer cases.
I know people have been frustrated because I've read articles, people who didn't get the vaccination and have got COVID 2 or 3 times. I know it's not common, but it happens, but that's really not surprising.
For unvaccinated.
Unvaccinated,
Right.
correct.
But we're also starting to see, which starts to make the argument for mandatory vaccination, I probably shouldn't say this, sort of less effective, because multiple people that have been vaccinated have had COVID multiple times. I took a little poll in a room we had yesterday at a meeting, and there might have been about 12 of us, and I said, how many people here have had COVID? And I think there were 3 of us that hadn't. I'm one of them. And multiple of them have had it 2 or 3 times.
But what's the severity of what they get? Is it?
Oh, much less. When
Right.
we had that little cluster, some people
Yeah.
didn't even really know. They thought they had allergies because it was pollen season.
Right.
But when they heard other people were positive, they started testing themselves at home. So some people would have never have tested if they didn't know they had had an exposure. So it's much more mild.
And I think that that's a good point you just made too, is that there are times when, now, from my standpoint, to my knowledge, I've never had it, but am I sure?
Right.
I don't know. I mean, I've never felt like I've been sick, but I think you just don't know in many cases, and people don't even get tested in some cases.
Right, absolutely. Especially in the beginning, people didn't know. But my brother just had it, and he was much sicker than he had when he had it the first time in the beginning of it, and has had some lingering effects. So I guess there's still, even though for most people it's less severe, you don't know if you're going to have a severe case of it. So the more things we can do preventative, the better.
I know you folks at the center are doing a lot of stuff to, as you said, you're trying to get people the vaccinations. I know the city's continuing with their efforts too, because I know that they have the testing once a week or twice a week, and they still are giving out the shots too, which I don't know if every community is doing that, but New Bedford's still being aggressive in that regards.
Yes. I haven't really heard what's going on around the state. I don't think there's many sort of larger clinics that are happening. I think most of us are trying to get back to the business of taking care of all the people that didn't have their other health care needs addressed during the 2 years of COVID. So we have people with worsening diabetes, high blood pressure, asthma. So we're trying to get back to business as usual to the best of our ability.
And that's one of the things I was gonna ask you is, you talked about, I don't know if it was the first or second, you've been here a few times now, but you were worried about the people who weren't getting their care that they needed. So are you seeing now, as people are starting to filter in with non-COVID related issues, that some health issues are getting worse?
I would say sure. I think some people managing their medications during this, sometimes if they didn't come back, sometimes they run out of medication and they didn't come back and get back on their blood pressure medications. So we're really starting to look at all the chronic diseases and see what's going on with our population and reaching out to them. Some people really just haven't come into a health center. They're afraid because they know there are people there with COVID. And so there's a lot of barriers for getting people in to just manage their normal health care.
And I would think too that, again, you're the expert on this, but if you've got heart disease or something like that, that there's a double whammy there, because you got to take care of that issue, but you still got to worry about COVID too, that you can't ignore one for the other, I would assume.
Right. But we did. We had a lot of things postponed over 2 years. No elective surgeries, and obviously elective isn't critical, but it might lead to a worsening of whatever the reason was someone was going to have an elective procedure. So I think there's a lot of backtracking. And I think the other big thing we're seeing is mental health. I think this has put a huge strain on our society as a whole. People are less patient and tolerant with each other. I think our differences have become more accelerated and divided. I mean, we also have that going on politically across our country, but I think COVID certainly contributed to that, as we each dealt with COVID in our own ways and maybe didn't necessarily agree with how you handled it versus how I handled it. And so I just feel that people are under stress. They had 2 years where they had no relief. I normally would say if you're having a stressful time at your job, you go home, you go on a vacation, you do something. We didn't have any of those tools available to us to improve our quality of life. And I think it's had a significant impact on the population, on our kids,
Well, I was going to touch
general.
upon kids and mental. I know the legislature just passed a package dealing specifically with mental health. That's one of the things they wanted to do before the session ended. But how are you folks helping? Because I know obviously you're getting mental health issues there,
Yeah.
which is, it's different. It's a lot of things when people think of doctors and stuff, it's physical, it's this. Mental health is a totally different game.
It is, and I'm really happy to say and be able to share with the public that we're starting to build a behavioral health department. We started it before COVID. We actually, fortunately, had gotten a big grant, a $3 million grant, to build a pediatric mental health program. So we have 2 licensed independent clinical social workers and 3 community health workers that can work with families that are experiencing stress or their kids are demonstrating some kind of mental health symptoms. And we were using that as a model to how to scale that across the organization for adults. But I just hired a psychiatric nurse practitioner, and we'll be starting in the fall, and we hired a social worker to go with that program, so we're going to be able to provide consultation to our primary care doctors on how to manage some of their patients that have psychiatric diagnoses or need psychiatric medications. That's a real specialty field, and it's an area where there's a lack of providers, particularly when you get out of the Boston area, and so we're really trying to figure out how we can address that gap in care.
Well, I know that schools, teachers and whatever have been dealing and talking about the kids, especially the younger kids, dealing with the mental health issues from this whole thing. And I'm not an expert. You just wonder how does that get dealt with, because you need people to help the kids.
Right, and add to that the language barrier that we often see in the city. So we might be able to find a social worker who would be really effective, but language makes it a challenging interaction if you can't speak the language. About 70% of the parents in our pediatric practice speak Spanish. So even if we can speak to the child, we can't speak to the parents, and parents are a really important part of treatment for mental health, obviously, because the child's living in a household and needs the parents to help provide the support they need to get better.
Throughout your career, and you've had a certainly varied career, we talked about that, but has the mental health issues been as difficult as they are right now because of what we've faced, or just the amount or the type of cases that you see?
I think it's kind of very interesting. I was just reading something in Psychology Today last week on vacation, and they were talking about that this generation talks about mental health. I mean, not my generation, the younger generation, more readily than we did. That was very stigmatized, and if you had someone with mental health in your family, you often didn't talk about it. Sometimes families didn't talk about it.
Don't talk about your feelings. You
Right.
bottle them up.
Right.
That's where they belong.
And this new generation, because mental health is so on the news all the time now they're also saying that we may be overcompensating for that stigmatization and labeling everything as like a diagnosable mental condition versus the normal stresses of life. I may be anxious today because I'm missing a deadline at work, or I forgot to do something that I needed to do, or we've had a death in the family, so there's stress. Those are kind of normal stresses that we can manage in normal ways. So I think we're kind of lumping everything into this big
Right.
bucket of mental health, and I think there's sort of the day-to-day mental health we need in order to function, and then there's people that have really diagnosable mental conditions that need chronic and persistent care.
Well, you hear that from teachers too, and I'm generalizing, obviously, that there are kids that they say need to be on a program or whatever, and sometimes the teachers will say they're just kids
Right.
who are active, and it's
Right.
not really a mental health issue. But the parents are, and and I'm not an expert in that, but it just seems to me that sort of those issues are happening. Have been increasing over the last couple of years, and you're just like, okay, I don't know.
Right. Our pediatricians have an interesting philosophy about it, and it makes a whole lot of sense. They said, we don't want to give a kid a diagnosis at 5 years old that you have X, right? Because
Right.
are we labeling you and putting you into a pathway of something that might be just a time in a kid's life that they need to run around and release more energy? we used to run around more as kids
Yes.
than we do. And so
Yep.
kids have this energy pent up, and many of them get diagnosed with ADD, right? Attention deficit disorder, when really if they ran around in recess for half an hour, they'd get back in the room and be more settled down. There's data that shows that, is that if kids run around and have, they call it bursts of energy, get rid of that burst of energy, and then they can come in and be more attentive to learning. So has everybody really got ADD, or, is it a few really that are diagnosable, but the other kids just don't have another way of releasing that energy? So again, I'd say we've kind of tip the scale the other way, that everything is a severe mental illness.
That's probably one of the things you've been dealing with too, is during COVID, people have been less active. People have got issues now that are related to weight gain and what have you,
yeah.
and you don't even think about that.
Right. Yeah, weight gain, I would say, what do they call it, the COVID-20 or something?
I haven't even heard that, but yeah.
That many people gained 15, 20 pounds during the adults, and we've seen some children, and we actually are doing a little study of our child population, because the number of kids that have moved into the obesity scale is pretty significant.
I'd be remiss, we got a few minutes left, I'd be remiss if I didn't ask you about the recent Supreme Court ruling about Roe v. Wade and the abortion ruling. I know Massachusetts obviously seems to be an outlier, but just sort of your overall aspect of how that ruling impacts health and health of women.
Well, I think it puts the subject of pregnancy and what a woman's choice is back sort of under the radar, where we won't talk about it. And so if we don't talk about it, women will make decisions that aren't in their best interest, because I think they'll wait too long, and then it'll be a late pregnancy that'll be harder to make a decision if abortion was something that you think would have been helpful to your life. Of dangerous abortions, I'm old enough to have had teenage friends that made choices in the state that I lived in and didn't have access to abortion, and took trains to places and had bad procedures and bad outcomes. And we're going to see that happen, and it's going to increase the divide of health disparities in populations of color and people that are poor, because people that with means will still have access to abortion. When we say there won't be abortions, there still are people that can get abortions in medical facilities that are clean and safe, and it'll be the disadvantaged women that won't be able to have that access. And that's a very unfortunate place as a country that I thought had moved beyond that.
And it seems it's the states that are the poorer states. Like we said, Massachusetts seems to have a good ruling. I know that those states are looking at laws that would penalize the healthcare provider if somebody did go out of state. From when you look at that from a legal point, or from your aspect, and again, I know that the health center doesn't do that, but the liability, I guess, of someone a doctor from, say, Massachusetts who performed an abortion for a woman from, and I'm just throwing out Louisiana. What are your thoughts on that?
Yeah, that I think is going to be new case law, right? I think Governor Baker, I think, is proposing a law to protect people in Massachusetts, providers that do it. But that I don't know, does that protect another state from making a case against what's happening in Massachusetts? I just think this is so overwhelming to women, and I think society as a whole, that I don't know where it's going to end. And it's such to me, creating confusing messages to society. One day, we talk about guns and not limiting access to guns and allowing people to carry, and then we're talking about pro-life, and I think more guns kill people than abortions are had, and it's kind of a sad state that we're giving these messages out to our world.
And you must, not you personally, but your staff must have to deal with obviously those sort of pregnancy issues because obviously New Bedford is a poorer community. Right. Access is available here for healthcare needs, but you are consulting with women in your field and in your facility about those sort of issues.
Yeah, and timing good. Again, we started in January to implement a program called Upstream, and basically it's trying to get upstream on reproductive health for women. So to begin to have conversations with teenage girls about reproduction and making choices about healthy reproduction. You know, when is a good time for you to have a child, so that we're training all our providers to know all the different birth control that's available, so that if we can prevent a pregnancy that's unplanned, hopefully we can reduce the number of abortions. And that has actually been happening. So it's interesting, we're taking this right away at a time when there is less abortion, because there's more focused on don't have that unplanned pregnancy. Plan for your reproductive health.
I think the biggest thing that surprised me too is the rule with the ruling was there's just no exceptions.
Right.
And I think that you know, we can argue about, quote, abortion in general, but the no exception just surprised me too.
Yes, I think that, I think on the same day that that came out, I read a story, and I don't know if it was the Globe or something, about a woman who was pregnant with a child that was missing like a major organ, and they were going to be born and die anyway. And so at 6 months made the decision to have an abortion, and that would not be allowed today. So this woman would have had to carry for 3 more months a baby that wasn't going to be born to live anyway. So I think it's kind of atrocious. And then I think about women that get raped and think they have to carry a child, and that's got to be re-traumatizing them every single day.
Right.
And I know we say, well, somebody would adopt that child, but there's still, that's a life that's been ruined by that rape and that forced pregnancy.
Right. Well, it's good seeing you. Lots of things on the table. Anything you need to mention to folks about things that are coming up at the health center that you want them to know about?
Well, we have a brand new administrative building, which I'm really excited about. So we're going to have more room to expand some of the services that we have at the health center. And I guess I'd just do a little public health warning. Seems like there's been a little increase in drownings this summer. And that's a really important thing in summer, to make sure your kids are swimming in a place that there is really good lifeguards and protections, and watch your kids, because in 1 second a child can drown. So
Pools and everything else
dangerous.
too. I mean, we're fortunate in New Bedford to have the beaches with lifeguards. Doesn't mean that things can't happen, but I think pools are one of the biggest worries too around here.
For sure.
It's good seeing you.
You too.
Thanks for
Jim.
coming in. Cheryl Bartlett, our guest. We thank her for coming in as always. That's going to do it for this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network. Thanks for watching, and we'll talk to you again soon.